My name is John Flett. I'm a paediatrician at the Hillcrest Busamed Private Hospital in KZN. And I help parents, family, teachers who deal with children and think and learn differently. What is effective treatment of ADHD? Now, for most of you, you're going to think about medication, you're going to think about the strength of the medication, you're going to think about diet, you're going to think about making sure that your child behaves correctly. Well, I'm going to help you understand from my perspective, the most important thing about effective treatment is having a proper assessment and diagnosis and understanding what is ADHD. That is the biggest challenge that I have in my practice, is demystifying, debunking myths, helping parents understand what they think they understand. Often even teachers, doctors, pediatricians, neurologists, psychiatrists, psychologists. The other day I had a psychologist who was treating a child for a problem that was not a problem of poor sleep or behaviour, but actually had ADHD. When they were on the right treatment, they'd spent 2 years with therapy, completely wasted to some degree, and missed opportunities. Often children, having a proper assessment is teasing apart, understanding what the problem is, making sure that you understand what the problem is. Understanding is effective treatment. A proper diagnosis is effective treatment. Because when you understand, what the problem is, what the problem isn't, we know that whether your child has anxiety, has a learning difficulty, learning disability, we've been able to exclude those problems, sensory problems, eating problems, medical problems, sleeping problems, exercise, self-esteem, and yes, ADHD. So effective treatment is having a holistic approach. And unless you're able to get that holistic approach, you're able to make sure that we put our fingers on exactly what the problems are. Treatment on isolation is not going to help. Someone just prescribing a drug and a medicine and a medication, trying to up the treatment. Often I find that, when all those other problems haven't been dealt with, and you're just given a drug and the dose has increased, and your child's got a learning difficulty, and then the medicine's not effective. You become frustrated. Parents often then have children that don't eat, don't sleep as a result of drug dose side effects, become unhappy, frustrated. Parents then try lots of alternative treatments, neurofeedback, brain train, all these weird things, Reiki therapy. And I understand why they do it, because they're frustrated, because the traditional system has let them down. So effective treatment is a proper understanding and a proper diagnosis. Then you can get the right help and you can get the right direction.